Hello, my name is Dr. Vivian Antonopoulou, a Senior Research Fellow based at University College London, and I'm part of the Policy Research Unit in Behaviour and Social Sciences. Our project explored how health professional responses to patient complaints can be improved by a behaviour science approach. Over the last decade, the NHS has seen a significant rise in clinical negligence claims costs, despite no evidence of an increase in injuries as reported by the National Audit Office. In response, the NHS has introduced specific guidelines for complaints procedures, such as the Saying Sorry campaign, but uncertainty remains among health professionals regarding effective complaint handling. We know from previous research why patients may raise a complaint, but we don't know what influences how complaints are responded to. Given that health professionals' initial responses can significantly influence the course of a complaint and consequently its impact on those affected and the wider system, it is important to understand these influences and how they shape behaviours. To address this, we conducted a systematic review spanning the last 2 decades to bring together ideas and data from across the evidence base. We supplemented that data with interviews with 11 health professionals and 7 service users to identify what drives a positive or a negative first response. Lastly, we developed a behavioural map to demonstrate who is involved in complaint handling, what actions are taken, and what might impact outcomes. We found that health professionals' responses to complaints are driven by individual and organizational openness to feedback, resources to engage in complaints, communication skills and emotions. Health professionals often see complaints management as secondary to their core responsibilities, leading to challenges in prioritization. Limited time and resources exacerbate these issues. Organizational culture plays a pivotal role in shaping perceptions and complaints management approaches. For instance, a culture of blame can instigate defensive practices among health professionals, impacting the quality of care provided. We developed a set of recommendations, including targeted training to enhance health professionals' capability to manage challenging situations, creating platforms for sharing complaints and learnings, restructuring electronic databases for comprehensive oversight, offering social support including advocacy to patients, and increasing managerial support for those facing formal complaints. Importantly, we propose reframing organizational narratives around the meaning of complaints and shifting from a policing function to an improvement function. Working with our practice and policy colleagues to implement these changes, we hope to drive a more responsive and effective approach to managing patient complaints across the NHS.